right. Just to get an idea who I'm talking with, because I've seen the worst of the worst. I've helped stage 4 cancer and Parkinson's all the way to Olympic and pro athletes. So just to have an idea here, who's already pro or semi-pro or aspiring to be? Pro, aspiring? Okay. And then the rest is hobby or? Okay, amateur. Okay. All right. So the majority have higher levels.
We got a high level fighters in here. We got those here for self defense and fitness too.
Okay, awesome.
We got a mix of everything, but we have a lot of elite athletes.
All right, so I'm kind of going to go over a system that's taken me a little over 20 years to develop. And I've studied 4 different chiro schools, 2 different medical schools. I was a certified personal trainer since the age of 14. So all I know is the human body. And I always wondered, from rehab to power training, like, how does everything fit, right? So for the last 20 years, I've been developing what I'm going to explain to you right now. And so if you can kind of imagine 4 different progressions or categories, right? Here is where most people are in breakdown, okay? And breakdown is when your body isn't functioning properly, and it happens before pain happens. So you can picture it like, if you're older, you can what the example I did with you. He didn't have any pain in his wrist or his forearm, and I specifically asked him. Oh, you didn't?
No, you didn't know.
Oh.
You just asked me what was the tightest muscle at the moment.
Okay.
My forearm.
Yeah.
I didn't tell you about my wrist. And
yeah.
Whatever you did, I was doing push-ups, bro. I'm like holding my weight on. I couldn't even put weight on it. And I remember telling you like 2 days later, you were like, you didn't even tell me your wrist was hurt.
Yeah, because I was trying to search for something that wasn't painful, just to show people that, like, if you're treating your body like a Ferrari, you don't have to have the emergency brake all the way up. You could have it halfway up, and it already stops you from doing stuff, and it starts burning things elsewhere. And what happens to your body, then your brain says, okay, all I have to do is increase power. Then the wear and tear happens faster, right? So the difference between the athletes that make it to Olympics or pro levels isn't talent, right? Talent is almost matched almost everywhere. It's the things that they do in order to increase their longevity that lets them be consistent over time, doing the reps, doing the work, everything that it takes day in and day out. That's why they get to where they get to. And so the first step is to get you out of or avoid breakdown, okay? And as far as pain or breakdown goes, there's only 4 things that cause pain, and most people only take care of 1, and at that, it's incomplete. So a lot of people, when they look at pain, they only look at structure. My knee hurts. Okay, let's look at the knee. My elbow hurts, or whatever hurts, they look at that. And that is incomplete, because let's say my muscle or my tendon hurts. Well, is it really the muscle or the tendon? Most of the time it's something else. Okay, and I can present this in much more detail if you guys are interested in any one of these subjects that I'll talk about. Just pick and choose what you would like, and I'll come and talk to you about any of them. But as far as breakdown is concerned, structure, and at that, most doctors and therapists don't even take care of, like, let's say, for example, there's a nerve, a tiny nerve that goes back into a nerve. Let's say I have this nerve right here that stimulates my bicep to contract. I have another nerve on that tells my brain how that nerve is actually doing. That's called nervi nervorum, okay? And that's wrapped in fascial tissue that can get stuck to itself or to the muscle. If it gets stuck to the muscle, anytime you use that muscle, that's yanking on that nerve, and you think it's a muscle problem. Okay, because organs don't have sensory tissue. So that's why if you have a heart attack, what do they say hurts?
Shoulder,
goes down this way, because you don't have sensory in the heart. So it'll go to a muscle, right? If you have digestive problems, you're shutting down your core, so you're not stable, and you might not be knowing it. So your power is off. Okay, I took one of the Jamaican athletes pre Usain Bolt. And he was sprinting. You know how they run and the feet kind of turn out. So if you take a look at the distance between the line and the foot, right? That's the finish line. that's about 2 inches. Run that about a mile or at least a 400-meter run, and that puts you back behind everybody else putting in the same effort. It puts you back about 2 or 3 meters, right? So all I did was straighten that out and get him. The guy that won the race to replace when Lance Armstrong, I don't know if you guys know who Lance Armstrong is. So when Lance Armstrong went to retire, the guy that won the race for him, I actually did a move on him that increased his power output immediately by about 30% per stride. And yeah, he destroyed the field. So, and I did a lot of mental work with him because 2.5 years prior to that, he was a junior Olympian, and then for 2.5 years never completed a race or crashed or never finished it. And I worked with him mentally because it's the mental aspect. Once you have all physical stuff aligned, it's whoever wants it the most. And just to give kudos to you guys, I can neurologically back that the most highly expressive sport in human nature is combat sports. I can put it against volleyball, basketball, football, you name whatever one. And the only sport where you have to worry about somebody else, where physical fitness can beat somebody with more talent, where talent can beat somebody that has more physical fitness, where heart can determine if I have more physical fitness and I have more technique and I got discouraged by a punch, I could lose because I don't have heart. I can lose because I'm not paying attention. I can lose because I didn't sleep well or recover well. I can lose because I didn't give my body what it needed. There's so many different aspects, not including reaction time, decision making, right? So the physical expression, the mental expression, the emotional expression, right? The highest level, in my opinion, of sports is combat sports. So I love talking to you guys. I love doing my best for combat sports because it's the highest expression of physical performance in the human body. Now, once you avoid, because I told you about structure. That's one thing, right? So the other thing that most people don't know about, in one of my postdoctorates in neurochemistry, we were asked to draw out the the mechanisms of a concussion. So if you get a blow to the head, what happens in the brain in order for a concussion to occur? So we draw that. Now, 3 weeks after that, we were asked to draw the mechanism of when the blood-brain barrier has a problem. Now, just to explain, your body circulation has its own blood, and only specific things go to the brain. It has like a gate that doesn't allow other things to go. Only special things can come to the brain. If that is disrupted, there's a whole lot of issues, and we had to draw it out. We had to draw the mechanisms when there's a problem there. To my surprise, when I was doing that, it's the exact mechanism that I was drawing that I did 3 weeks before of a concussion, which means that you can chemically concuss with no trauma. That's how important your nutrition has to be. If you do not give your body the parts in order to repair or recover, and you're trying to build a building, you will be made of cardboard if that's what you're eating. You will not have iron, you will not have cement, you will not have steel, right? You'd have, plywood, and you'd have paper, and you'd have whatever rusty other treat you think you're giving yourself because of sugar or because of energy or because of whatever. And that accelerates wear and tear in the body, okay? To the point where even decision making, because you won't be able to produce the neurotransmitters possible to be able to react, right, is deficient. And so your body will break itself out in order to get what it needs if you don't feed it, okay? So we have structure, we have neurometabolic, then we have environmental, okay? So stress, the toxins from the environment, family, relationships, trauma, all these different things can also affect and take toll on your body for breakdown, okay? So we got structure. What's the other one? What? Neurochemistry, right? Neurometabolic. The one I just mentioned is environment. And the last one is the brain. Raise your hand if you've ever heard of phantom limb pain. Ah, yes. Okay. All right. So in the 70s, 80s, 90s, when it wasn't known, they used to send these people. And for those of you that don't know, if I'm amputated, let's say from the knee down, I only have a stump here, right? My big toe on this foot could itch or hurt or burn, even if it's not there. Okay? And for a long time, they would send these people to the psychiatrist. Oh, it's like they had trauma, it's in their head, whatever. Today, we very clearly know in neuroscience that the way the body is represented in the brain is very specific. Okay? So, like, feet are over here, and we continue down this way till we're like on our mouth and head over this way. And this side senses this part of the body, this side senses this part of the body. So I can have a neuron firing just because the hip is next to the knee is next to the toes, right? I can have a neuron firing in the brain and misrepresent what's going on over here, which means that just because this or this or this hurts does not mean that the problem is there. And that's why most people continue to go from doctor to doctor, therapy to therapy, and then they undergo surgery because this two-dimensional snapshot of a picture, right, of like an X-ray, an MRI, a CT scan, right? It's like trying to explain a movie by taking a picture. I don't care how good the picture is. Would you be able to tell a movie with a picture? That's the same thing with an image, okay? It's the same thing with taking a blood sample. All right, that's supposed to be super specific. By the time your body is deficient in blood, in anything in there, your body has already exhausted everything it could so that it can maintain homeostasis, equal amounts of everything here. The blood is too important. Okay, so if I take a snapshot of this and by that I determine what your body's doing, that's really poor too, because it should be changing, whether I'm awake, whether I'm asleep, whether I'm stressed, whether I just finished training. It should be changing, right? So all these different snapshots to try to tell me the whole of the human body is incomplete at best, okay? So now we have these four things that should be looked at, where most people only take a look at one. You should look at all of these in order to determine what's actually going on. Now, once you've avoided pain and you've avoided breakdown, then you can move into the next one, which is health. And I've given lectures to more than 500 people at a time in different hotels full of doctors, surgeons, nurses, personal trainers, massage therapists. So a lot of health people, and I get them rallied up, and it's like, okay, we get people healthy, right? And they're like, yeah, we get people healthy, and they're like, the whole health industry is there. And I say, okay, what's health? What's health? What? Okay, that's pretty close. So most medical doctors, right, or most in the medical term, they'll say the absence of disease, right, or the absence of symptoms. And so I say, okay, so the person that all of a sudden had a stroke was healthy 10 minutes before that? Were they healthy 10 days before that? 10 months before that? Do you know how long it takes a cancer cell to express itself in the body? 7 years. Okay. Now, I thought I was hot stuff until the last neuro symposium that we had, the World Symposium in Neurology, because I'm able to physically detect dementia or brain issues about 10 or 15 years before they take place. And then the world leading expert just whooped all our butts because he talked about all those and said that he can predict it 30 to 40 years before. And he showed I don't know how long it took his study, but he actually showed the entire progression to show that you can actually predict dementia 30 to 40 years before it happens. Guess the number one spot where dementia starts. Where? The gut. Holy, what do you do? So there's a direct connection between your gut and your brain. And people treat their gut like crap. And so the nerve, the biggest nerve in the body, cranial nerve 10, the vagus nerve, which directly goes from your brainstem to your gut, actually starts breaking down here to the point where, since that nerve alone controls your heart, your lungs, your liver, your pancreas, your spleen, your large intestine, your small intestine, etc. That one nerve, okay? One nerve from here controls all that. You start messing up that nerve, you cannot repair, recover, digest, heal. None of that happens. And so now you're overly sympathetic, which means not only are you wearing and tearing your body, but you're doing that for your entire nervous system and all the other systems of the body. Okay? So the whole gut-brain connection, so much so that there's a direct medical term that if you have a problem with your liver, there's no way around it. You have a problem with your brain, called hepato, meaning liver. Hepatocytes are cells from the liver. Hepatoencephalopathy. So if you have a problem with your liver, hands down, no questions about it, there's a problem in your brain, period. That's how well connected they are. Now, do you know how many functions the liver has? Known today, because we still keep discovering, but known today, numbered, how many functions does the liver have in your body? Give me a guess. 500. I said 600, and I said 630 when I was in school about 11 years ago. And I was corrected because everybody else was saying 20, 30, like whatever. And I said 630, so everybody looked at me like this. And that's the oldest information I had. Well, that professor, who was doing leading studies in Turkey and coming back and forth, actually told me, or told our group, there's more than 1,700 known functions of the liver. Okay? From producing your hormones, your neurotransmitters, detox, protection, a whole lot of things happen in the liver. And guess what? There's no test in labs that can tell you when your liver is going to be affected until what percentage damage you think the best of the best labs could tell you if the liver is damaged. Like if it's 20% damaged, if it's 90% damaged, that's when tests start to be abnormal. 90. So if you guys want to wait that long, same thing happens with the pancreas. Same thing happens with the kidneys. Okay. Now, an MRI is supposed to be real specific, testing the brain, right? Like it'll pick up the most minute detail of the brain. Do you know what percent of the brain has to be damaged for an MRI to pick it up? Who said 60? 70. Do you imagine 70% damage for an MRI to finally pick it up? Otherwise, they tell you you're normal. Isn't that crazy? So we have breakdown over here that we needed to look at 4 things. What do we look at for health, and what's the actual definition of health? Health is when all systems of your body are performing optimal. Okay? That's health. If I have an issue with my musculoskeletal system, I'm not healthy anymore. If I have issues with my hormones, I'm not healthy anymore. If I have cancer, if I'm obese, if I have autoimmune conditions, whatever I have that is not optimal is not healthy, period. That's it. Okay? You're in breakdown. And you need to follow these things and come out of there to be healthy. Now, how do we get people healthy? Because if this room full of professionals that I've spoken to can't tell me the proper definition of health, how are they going to get you healthy? Medication. You know what I did in a seminar? You know what's really crazy? And right? You get your meds, you get better. So check what I did, because I did get that answer. You're not the only one to do that. So I said, okay, anybody here on meds, raise your hand. And I had a whole bunch of professionals still raising their hands. And I asked how many. You know, my average was between 5 and 19 in a room full of professionals. So I averaged it out. I said, okay, anybody have them here with you? So I brought them up on stage, and I said, all right, so now this, and I'm pointing to the medications, this is supposed to get this person healthy, right? So I said, okay, so if this is going to get this person healthy, and I start opening it, like, you mind if I take a few? And I'm doing this live, right? I'm saying, I'm just going to chug a few of these, okay? and they're just like, you could just see everybody's eyes. I'm like, why, you guys worried? And somebody started saying, hey, that's no joke, like blah 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 blah, right? So I got the room talking. But I'm like, would you be worried if I did the same thing with a handful of blueberries? But this is supposed to make you healthy, yet a healthy person would take this and then potentially die? Like, are you kidding me? So anyways, that turned into a long conversation full of medical professionals. So it was juicy. So all right. So then the thing is, how do we get healthy? So I took this from two-time Nobel Prize laureate. His name is Alex Carrel. He did an experiment with chicken cells and actually got them to live way past what they're supposed to live. They're supposed to last a few days on a petri dish. He got them living actually months at a time. And what he found out was there's 5 things that every cell needs in order to survive and thrive. It needs fuel, needs oxygen, needs the ability to eliminate toxins. It needs to avoid trauma, because if you punctured the cell, even on a perfect petri dish, having everything that it needed, it would not put itself back together. Okay, so avoid trauma. And then if there was any disruption in the electromagnetic composition of the cell, meaning the membrane, and you have charges coming in and out from the different substances, if there's a disruption in that and it disrupts the membrane, the cell dies. Okay, so how do we apply it to real world? Anybody here been in the military or done any survival stuff? All right. Do you know the rule of threes? So normally if you're really out, they'll teach you the rule of threes, which means you can live 3 minutes without air, 3 hours without shelter, right? So most people, if you're cold and you lose dexterity, you got 3 hours. So you start looking for water before you look for shelter and proper cover, and you'll be dead. So first, if there's a fire here, the first thing you're going to do is drop and look for air, right? Because if you have no air, nothing else matters. That's why air is the most important. Then we go to shelter, right? Keeping homeostasis in your body. Then 3 days without water, 3 weeks without, and 3 months without. Nobody knows this one. 1944 experiment. Without love. Human contact. Okay? So in 1944, the babies that were orphaned were given everything that they needed in order to survive. All food, all water, all changes, everything, sterile environment, everything was taken care of. And these babies at the 2.5-month point started to die. And they discovered that if you don't look into the eyes of a baby or touch it, it does not feel important, it does not have the will to continue, and it dies. Okay? So it is human, the nervous system is a real thing, and we need to know how to stimulate it, which is why I've dedicated pretty much my entire life to figure these things out, right? So how do I apply this to the human body? It presupposes that you know what all systems of the body are, right? So how many systems does the body have? Name me a few. Come on, you guys are smart. Nervous, skeletal, muscular, cardiovascular, digestive. Good. Hey, reproductive. So you guys reached the average that I get with health and fitness professionals, right? Which is 5 typically that they give me an answer. 6 was from this group. We actually have 11 or 12 depending on how you divide the lymph system and the immune system, right? Because we have the endocrine system, right? Skin is its own system. It's called integumentary, right? You have a respiratory system, right? So we have 12 systems. You have to look at all of them in order to determine if you're healthy or not, right? Just as the cells need everything that they need in order to survive. Now, in addition to these 5 things that every cell needs to survive, you have one type of cell in your body that if it doesn't have this, like any other, it dies, but it needs one more thing that no other cell in the body needs. And if it doesn't get it, it dies. The neuron. The neuron needs stimulation or it dies. If it doesn't send or receive a signal, it dies. Okay? It goes through something called TND, transneural degeneration. So right before it's going to die, it works up really quick and then it dies, which is what happens when you drink coffee. And that's why it brings you up. Those neurons eventually die. You need to wake up the other ones. Those eventually die. You need to wake up the other ones. Okay? So the neuron needs stimulation. Here's the trick with neurology and neurons. Too much, too little, the wrong kind, or no stimulus, all of them kill the neuron. I'll exaggerate my example so you understand what I'm saying. If I covered your eyes for a period of 3 to 5 years, pitch black, you will have a very hard time, if not impossible, to see again, right? If I shine a cop light in your eye and I just keep it there, that's too much. So too much, too little. Now, I asked this to a group of nurses, is walking healthy? And then I tell them, do you know I currently have patients that if I tell them to go walk, they could potentially kill themselves? Like they could die from that? Wrong kind for them. You've heard osteoporosis? The safe answer is go swimming and do aquatic exercises. Because there, based on my information, you didn't fracture. But I'm just saving my butt. Meanwhile, you're over there thinking you're exercising and you're not putting pressure and stimulus for the bone to actually grow. And so eventually you fracture, but I protected myself. That's the wrong thing to actually tell somebody. You should same as you guys with training, you should progressively know how to overload a patient, because when we get to the talk of fitness, I could train my squat so I can go to the toilet properly. I could do a single leg squat to get in the car, right? Or I could do a single leg squat with a lunge, a twist, and a push to do a pitch, right? So a combination of movements, and we're going to talk about that when I get to fitness, right? But as far as health is concerned, you have many different levels of health in order to determine if you're healthy or not. Now, people that were in breakdown, most of the time, try to take care of themselves through fitness, skipping health because they didn't know the definition, or they would say health and fitness, mixing both, and they're totally different. And if you, on top of relationship stress, financial stress, you didn't sleep, you didn't eat right, and you keep adding these stressors to the body, and on top of that you add exercise, which is a stress to the body, your body, if not healthy enough to recover, will obligate you to rest in one of 3 different ways. You're going to get injured, you're going to get sick, or you're going to get physical exhaustion. And you're right back over here. And that's the cycle that almost every single one of the athletes that I've seen always does. And weekend warriors or anybody trying to do health, they're trying to lose weight, they go right to fitness, then their knees hurt or their hips hurts. They stop doing that because they suffered breakdown. They try it again. I can't jog. I can't do that. They don't know how to get healthy enough to be able to withstand the level of fitness for their chosen activity. So, breakdown, health, fitness. So let's talk about fitness. What is fitness? What is? Okay. Okay. So, okay. Look, fitness. The ability to perform an athletic activity. That's it. That's it. The ability to perform an athletic activity. That presupposes that you know how the brain programs movement. Okay? And there's people that have lists of 20 something and people of 4, I have 10. Okay? I don't care how you want to combine them, but for me, it's very simple and easy to measure 10 different things to get you to the next level, which is high performance, right? So that's why I'm talking to you this, because I eventually want to get to elite athletes, right? Elite performance, whatever you want to call high performance, whether it's whether it's going hiking with friends or competing at the highest level in a sport, right? That's this. But in order to get there, you need to know this. And in order to recover properly from this, you need to be healthy. And in order to not pay attention to pain while you're being healthy, you need to be able to avoid that, right? So that's why I've sequenced that way. So fitness, the ability to perform an athletic activity, patterns of the brain, squat, push, pull, twist, bend, lunge, gait, which could be walking, jogging, running, sprinting, right? They all have their levels, right? Squat, lunge, push, pull, twist, bend, lunge, gait. Stability, which comes before balance, right? You need to be able, I can't move this arm if this is unstable, right? And so if I would demonstrate that, like saying, okay, is it easy to lift up like a 5-pound dumbbell? And then I'll put you really off balance, and your body's not going to let you do it if you're not stable and if you're not in balance, right? So stability comes first, then balance, then coordination. So those are the neuro aspects of all these movements, okay? You test each one of them, and then you determine what you're going to be doing, right? And that's the level that you train these, right? So, and then elite performance requires a ton of mental aspects and neurological, meaning raise your hand if you've had a goal and been really close, and then be like, be honest. Yeah, right? You're so close, and then you're like, okay, I'm close enough, right? And it's because the part of the brain that allows you to seek a goal is not the same part of the brain that makes you attain it. They're different parts. Okay? One is on the right side of the brain and one is on the left side of the brain. Okay? So if you don't know how to neurologically trigger goal setting, you can write them all you want. You can wish for them, hope for them, do auto-suggestion. You can do all these things, and it won't work as effectively as teaching the nervous system to actually reach it. Okay? I can talk more on any of these subjects. I hope you guys got something out of it. If you have questions, I will stay here and answer anything you guys have. As far as pain is concerned, I didn't have this part of the equation. That's the part that's new, because my bread and butter was health, and I started with performance because I'm obsessed with power development. So I did a lot of stuff with vertical jump, explosiveness. I track the velocity of the bar with I did all Louis Simmons train, like everything that you can think of on the training side, I've done. And that's what I was obsessed on developing. But I noticed that my elite athletes couldn't even do proper motor programs, so that's why I developed fitness. Then I noticed that they couldn't recover or do proper fitness because they didn't have the health to recover. Two great stories is that Jamaican team that I was talking about. I took all their athletes, and the ones that participated in the gut protocol that I did for them, every single athlete PR'd. This is track. So do you guys know Sha'Carri Richardson? Okay, so I taught her coach how to train, which was Dennis Mitchell. He was the captain of the U.S. team in 1996. So I showed him my method of training way back when. Okay, and so they PR'd just by doing a gut protocol. One of those athletes, I actually require my athletes to sleep with a heart monitor. And if they have a resting heartbeat that's 4 beats or higher than their normal resting heart rate, excuse me, I don't let them train. I do a recovery day for them. And so I had this one track athlete who I was new to, right? So I tell him, hey, what was your heart rate? And it was actually 5 beats above what he had previously. And I told him, hey, you have a recovery day today. Need some water. Excuse me. So he had 5 beats above his normal resting heart rate. I told him to take a rest. He didn't listen. I'm here to train. He wanted to be, well, he's qualifying for the Olympics. So, of course, He didn't want to miss a day. So he trained anyways, contrary to what I told him. And by the end of that week, he was 2 weeks off because he was sick. And remember what I told you about fitness, right? And not being healthy enough to withstand it. So 2 weeks off from that day forward, I could tell him to hop on one leg with his tongue out and he'd do it. So, so what I'm trying to say is follow the sequence in order to reach what you want to reach, right? Let's see. I don't know. I was saying that I didn't do this because I started with elite athletes. Then I did the fitness because they couldn't do the stuff that I thought elite athletes should be able to do. Then I did health. I've helped, from stage 4 cancers to the Parkinson's, right? So I've helped that, and that's what I continually did. But since I've started, people had continually come due to pain. And I would always do something real quick and get them good pretty quick, hoping that they would find a chiropractor, an acupuncturist, a massage therapist, a trainer, medication, surgery, I don't care, something that would help them with their pain, right? So I helped them temporarily, and I think that area was too crowded, so I was never going to touch it. And what happened over time, these people over the years, I kept getting people, knowing that I don't do any of that, they kept coming for pain. And I discovered that just by doing that, I was actually doing a disservice to myself and my time, and to them when they were coming asking for help, because they weren't getting what I thought they should be getting by going and seeking help. That's why I developed the breakdown patterns. That's why I was able to tell you the 4 causes of pain. Excuse me. And that's why I can tell faster than anybody else and recover people faster than anybody else if they do have pain or if they have breakdown, because I truly believe that nobody should be living in pain for any extended amount of time. That should be taken care of very quick. And if you get with her after, get the Instagram, you'll see all the different stories, because I did this with such a passion. I actually opened up my center to the community. I said, bring me anybody with any pain for any amount of time and give me 10 minutes or less. And you can see those videos there. And you'll see I've got athletes from all over. I had an 80-year-old woman walk in with a cane, had sciatic pain for 3 years. The video's on there. You'll see it in less than 10 minutes. She started dancing after. You have to know what you're looking for and doing. And since I don't think any of you guys should be in pain, if you ever do want to get rid of it quick, feel free to contact us, because that should be, I don't even want that to be a concern. You guys should be doing this stuff, So thank you guys.